Ladies and gentlemen, don't believe everything you see about health and well-being. There was a time when doctors used to endorse cigarettes. In the 90s, Colombians reported the highest level of satisfaction in the world. This was at the same time that they reported the highest level of random violence, murders, and kidnappings in the world. So how do we reconcile this dilemma? There are two options. They were either all high on cocaine when they were answering the survey, or they were all happy but dead. So now that we've known each other intimately for the last 50 seconds, I want to tell you that I know what you're all thinking about. You're thinking, where is his accent from? So my ancestors are from Moldova. I was born in Argentina. I lived there for 16 years. Then I moved to Israel. I lived there for 9 years. Then I moved to Canada. I lived there for 15 years. Then I moved to Australia, which is where I got my accent. And I lived in Australia for 3 years. And then I moved my accent when I moved to Nashville. So now that's my current accent. Then I moved to Miami about 4.5 years ago. So when you add it all up, I'm 27. So it's interesting to see that in the same survey where Colombians came first, Moldovans came last. Okay? So as I've told you before, my ancestors are from Moldova. So I think it's a miracle that I'm standing here in front of you laughing. Okay? Moldova is a very depressing country. Okay? So what about personal well-being? Well, you know that personal well-being is not about being happy while you're being kidnapped in Colombia, or about doctors recommending that you smoke. So well-being is about having meaning in your life, and having a sense of competence and mastery, and deriving meaning from what you do. So my son Matan is a chess player. We see him here playing with the master in Harvard Square in Boston. The master is not used to losing to anybody, so he was rather upset when our son beat him at chess. Now, but our son is a very good sportsman, and he's a good loser, not a bad loser. He derives a great deal of satisfaction from having this hobby, from developing a sense of competence, growth, meaning, passion in life. Right? So a sense of control over something is hugely important in life. So we really owe a great discovery to one of my heroes, Sir Michael Marmot. Marmot followed up the health and well-being of 29,000 people for over 30 years. And what he discovered was that no matter what, people who are lower on the chain of command in the workplace experience less sense of control and are always more sick, they have more stress, less control, and they die sooner. Okay? So he followed up, he measured their eating habits, their cholesterol levels, and this is what he found. We call this the social gradient, this red line that you see there. Administrators who had the most level of control over their workplace experienced 1/4 the risk of premature death comparing to clerical staff. And the professionals, I'm sure there are many professionals in this audience, who are only one notch down from the boss, they had twice the rate of risk of premature mortality. So next time your boss comes to you and complains about stress, you just show him this graph and you tell him to shut up. So I wonder if you know who these people are. These are Jun and Johnny Cash. And there is a very important lesson to be learned from Johnny Cash, who died 3 months after Jun Cash died. And what we learn from this, it's a very common occurrence that men die soon after their wives pass away because we men don't know how to ask for help. And it turns out that people who have more social support, they enjoy healthier and longer lives, they are more optimistic, and they resist stress and disease better. Okay, so we live in a culture that exalts the macho culture. I don't need anybody. We do this at our own peril, really. Now, I take my social support very seriously. So this is my adorable wife, Ora, who's sitting in the audience, and my son, Matan, who's probably playing chess somewhere right now. And moving from personal to organizational well-being, it's really important to understand that we're all affected by the organizations with which we interact. And it turns out that organizations that are supportive of their employees are really much more effective and reflective. Those are organizations that make more money and they really promote the well-being of their people. And I really wish that more CEOs, school principals, managers, CEOs of non-profit organizations would understand this. Organizations driven by fear do not make money and make their people sick. So there are many people who would like us to believe that well-being is largely determined by generics. Some people say it's 50% generics, 40% motivation, and about 10% social conditions. I rather doubt that formula. I believe that social conditions influence our well-being much more than just 10%. So let's have a look at some studies. When you compare the percentage of people in Denmark who said they were happy in 1973, and then you compare that again in 1998, you can see a considerable improvement. More people in Denmark said that they were happy and satisfied with life. Now, compare that with the percentage of people in Belgium who said they were happy in 78 and they were happy later on in 1998. Now, do you think the gene pool can change in 25 years? I don't think so. What happened was that the social conditions in Denmark improved and the social conditions in Belgium deteriorated. And social conditions really affect everybody. So I don't think that social conditions affect just 10% of our well-being. Now, the situation in Russia is much more pronounced. The percentage of people who reported being happy in 1981 was about 70%, and that went down considerably after the destruction of the communist system. The communist system wasn't much fun to begin with, but what happened afterwards was that every system of delivery, food production, delivery, it all really collapsed. So do you really think that this is the reason why Russians suffer a great deal of deterioration in their well-being? I don't think so. What happened was social conditions. So indeed, when you think about community well-being, there are three very important factors that account for it. As I was saying, social conditions, social capital, and inequality. And I will say a few words about each one of those. So first of all, about social capital. Social capital is a measure of our participation in civic affairs. To what extent we volunteer in the local church, to what extent we vote, we go to picnics with our friends, and the more social capital there is, the more trust there is in the community. Now you can see here some states that are high on social capital and some that are rather low on social capital. When we used to live in Tennessee, people used to say that the South is a very friendly place. This figure doesn't really support that notion. We used to have a friend in Nashville who used to say, Nashville is a place that makes you feel more welcome than you really are. Okay, so now, unfortunately, in Miami, we don't volunteer enough. So there is a lot of work to be done in building our own social capital. Unfortunately, people in Miami volunteer at half the rate of the national average. So there is a lot of work to be done. Now, moving from Miami to the international scene, you can see that inequality really makes a difference. Countries that are low on inequality experience much fewer social problems than countries that are high on inequality. You can see where the US is on that graph at the upper corner. And really, countries like Sweden, Japan, Finland experience far fewer problems with trust in the community, obesity, mental illness, teenage pregnancy, drug addiction. So there is a lesson here to be learned. Now, of all the social lies I could tell you about community well-being, 4 are especially pernicious. One, that we can improve well-being by focusing on people's deficits and pathologizing individuals who are not adjusting to our expectations. That we are going to improve well-being by reacting to problems, by being arrogant and telling people how to live their lives, even though we don't have a clue about their lives. Believe me, I'm a recovering expert advice giver, okay? And finally, that we can improve well-being by blaming individuals for their misfortune. This is a serious problem to which I offer 4 antidotes. We need to focus on people's strengths instead of their deficits. We need to concentrate on preventing problems, empowering individuals, and focusing on community change. So let me say a word or two about each one of these 4 domains. So to start with, many of you probably know Muhammad Yunus. Muhammad Yunus received the Nobel Peace Prize for building on women's strengths in Bangladesh. As opposed to stereotyping poor people like many people do around the world, he focused on their strength. And he believed that if people were given a good chance through microloans, microcredit, through the Grameen Bank that he built, people would be able to come together, work on their strengths, hold each other accountable, and repay their loans. Long story short, he lifted millions of people out of poverty. Now, let me tell you an important story about prevention. In 1854, there was a cholera epidemic in Stan's city of London, and people didn't know how to cure cholera. People didn't know what to do. So they called on this famous physician by the name of John Snow. John Snow said that he didn't know how to cure cholera either, but perhaps there was something he could do to prevent it. So through detective work, he figured out epidemiologically that people were drinking contaminated water from this water pump that you see right there. That's the famous Broad Street pump. So he didn't know how to cure cholera, but he discovered the source of cholera. So what did he do? September 7th, 1854, he ordered city officials to remove the handle from the Broad Street pump, and he stopped the cholera epidemic. Okay? Now, so I so love this story that every time I go to London, I have my picture taken next to it. Now, so what did we learn from John Snow? That no mass disorder afflicting humankind has ever been eliminated or brought under control by treating the affected individual. By trying to cure people, you are not solving the problem, right? You have to get to the root cause of the problem. And even if John Snow knew how to cure cholera, there would never be enough of him to go around to cure all the people who were sick, right? The only answer is prevention. The good news is that for every $1 invested in prevention, you can get up to $17 in return. The bad news is that governments invest less than 3% of budgets in preventing problems. 97% of budgets in healthcare go to contain disease as opposed to prevent it in the first place. So for all the talk of governments about preventing problems, they are not really investing much in it. So now a few words about empowerment. You know that empowerment is hugely important to give people a sense of control, which is what these giants on the screen have done for their people. They have given a sense of control to their communities. Now, what have we learned from them? That empowerment can be a tool for social change and personal healing at the same time. At the same time that you're fighting for social justice as an important cause, you're regaining control of your life. And we saw earlier how important that is. So now a few words about community change. And I know what you're all thinking. You're thinking, Isaac loves going to Europe to have his picture taken. Which is true. But only for educational reasons. So I'm sure you all know where this picture is from, right? Do you know what it is? It's in Venice. So what do we know from Venice? That Venice is sinking, right? So if Venice is slowly being submerged, individual citizens cannot afford to ignore their collective fate because in the end, they all drown together if nothing is done, right? So the only answer is community solutions. So let's hope that Miami doesn't end up underwater like Venice, at least not until real estate prices improve and we can all sell our houses. So we take strength, prevention, empowerment, and community change very seriously. At the School of Education at the University of Miami, we're partnering with these wonderful organizations here in the city to promote the SPEC principles, strength, prevention, empowerment, and community change, to improve internally the organizations, as well as to improve the communities with which we interact. And we have our website there, the SPEC Way Project. Now, if you really believe in prevention, I urge you to join the children's movement of Florida, headed by my very good friend, Dave Lawrence. They're really investing in the next generation. So given that I'm a professor, we're going to end with a quiz. Okay, so now you have to tell me true or false. The best way to eliminate disease is through effective treatment. False. You got it. Now, what about next? Colombians are happier than Moldovans. You got it. You're a good class. Now, last one. If doctors smoked Camels more than any other brand, Medicare fraud in Miami would be as bad as traffic and government corruption. Thank you very much.